Welcome to episode 4 of Practical Wellness Podcast. You are not going to want to miss this episode. It is all about big food and big pharma.
Hey, Jaysha.
Hey, Courtney. Where have you been? It's been a long time.
I know. I have been drowning in work and life.
Growing
Are you drowning
pains.
in tornadoes and rain right now? I saw the weather.
Actually, no. I think it's kind of
Really?
past us, so it's good here.
Oh, good. No, I've just been crazy. I've finally finished up in the ER, and I'm full-time at Forward Wellness now, so today is week number 4 as of today. So I'm just still catching up from everything that's been piling up around me.
Oh, yeah. It's kind of funny because I remember when you calling me and stressing about leaving the ER and starting your own
Yeah.
business. And I can remember doing that myself. But, girl, it's such a good change. And your life is going to be less stressful. And you're going to be able to make your own business and your own rules and your own. It's so enlightening on another level that
No, for
stressful,
sure.
completely
Yeah,
stressful,
yes.
but
Different,
totally worth
but
it.
good, better in a different way. So that comes with its own pros and cons, but I definitely don't regret the decision, but I'm taking it day by day and embracing the chaos. So
Yeah. So to our viewers that have been waiting on this episode, this is the reason, we've been growing. I've been growing out here, Courtney, and
Yes.
I know we've talked about that. It's that with growing pains, we've kind of got to make adjustments and, learn to adapt to them. And that's kind of
Right.
why it's been so long since we got this new episode out. So I'm glad we're here today. And we are going to be talking about big pharma and even maybe a little bit of big food.
And
Today's
this is
the day.
episode what, 4 or 5? 4?
This is episode 4.
Okay, awesome. It's
I'm
not very
right,
many,
right?
but it was hard. It was easy to lose count because I feel like it's been months, but it's only been really a month and a half since we've recorded last. So time moves fast and slow depending on the situation.
Gosh, it does. It does. But I'm excited about this one because, I'm excited to talk about this because I feel like it's something that we definitely need to get out there and, people need to understand. And one of the things that I want to make really clear from the get-go, Court, when we start talking about this is that we are not against pharmaceuticals. Science is an amazing technology. We have things that save lives, countless lives, and I
Absolutely.
can think about times that, you walk through one of your old graveyards. How many little children graves do we see? How many of these parents back in the 50s lost their children because of disease and things that we
Sure.
now have, medication and cures for. So I want to start by saying that, we are science believers. We believe that there are cures and treatments that come out of pharmaceuticals, but one of the big things that I found is there's a distrust for government, and there's a reason that there is. And a lot of things that grow big grow with problems, And once we realize that, these medicines work, everybody wants all the medicine, and it becomes more of a profit than it becomes doing it for the people.
I agree 100%. As things grow, things need to change, and then
Money
sometimes
talks.
they change for the worse and change for the best. And sometimes we have to take a pause and take a look back and see, is what we're doing really in the best interest of all people or just a few people? So
Yeah, because it can go out of control, and that's kind of what happens. But, when we talk about insulin was actually made and meant to be free for the public. But
Right.
that's not how it ended up. Right? How many of our diabetics struggle to get their insulin and struggle to get their medications because it became a profit-based, corporation. And that's exactly what
Sure.
Big Pharma is. That's a corporation like any other corporation. They make billions of dollars a year. They have life-saving medications out there that some of us will need in our lifetime. But what has happened is that they push all their medications. For instance, we have marketing pharmaceuticals, right? Do you realize that very soon we're going to be the only country that still allows pharmaceutical marketing on television?
yeah, I'm interested in hearing that because I know when we spoke briefly a couple hours ago before our recording, you wanted to look and see exactly how many other countries prohibited that. So
There's
share
only
that with
one
us.
other, and I couldn't find it again. I've been researching. If you know me, I research all the time, and I always come up with new stuff. But there was only one other country, and they're about to pass a bill that's not going to allow pharmaceutical marketing on TVs. And honestly, I am for that because what happens is they market to you and they say, this is the best drug for this. And then what do?
Sure.
You go to your primary care, you go to your
And ask
doctor,
for
you say,
it.
no, I want this drug. This TV said this is the best drug for me and I want nothing else. And
no, and marketing is powerful. We become,
it's
we're all
huge.
such consumers. You know, if you've ever taken a marketing course or even read an article on marketing, you'll be surprised. Like sometimes I wonder, like, is green my favorite color, or did the algorithms tell me that? Like, I don't even know. Like, did I make these decisions, or have I been forced, or not really forced, but like subtly over time through marketing techniques? And you walk down the street, or see a sign, or down the grocery store aisle, and there's things that are calling to you, and you're like, why though? So marketing is so powerful, and the psychology behind it is fascinating. So when you apply that to pharmaceuticals, it gets dangerous for sure.
And when you apply that to even healthcare models and big food,
absolutely.
That we're going to talk about as well, that marketing is huge. And a lot of the times they are able to, because there's rules and regulations that kind of, justify marketing and how we're allowed to do it. But there's so many things that they can slip through to where we have false marketing all the time. And you have no idea.
I mean, you see that with the big tobacco campaigns. I mean, I think most of us and most of our peers were around when that was still there. And then also when it disappeared, there was a big Artful Truth campaign that brought that to our awareness that, Joe Camel was marketing to children, and the marketing and tobacco became, prohibited because of the dangers that came with it. And so it's important to note that marketing is good. And, we use marketing here in our own clinics, and you want to be able to advertise and have, free speech or whatnot, but we have to be careful. And as our communities and our society changes with technology, it's super important to just take a step back and say, are we doing the right thing for all or for just a few?
For the people. But, I'll tell you, over the past 2 years, and the people that know me are like, Jaysha, what happened to you? Because it's crazy. I feel woke.
It's funny.
Right?
It's funny you say that. It's funny you say that because you and I talked about that recently, and I'm just, it is, and I shared recently with a patient of mine that, and I use, you use the word woke, but I felt like the curtains had just kind of opened up and I could see more that, my peripheral vision was widened. And, when starting your own practice and you start getting your own contracts for labs and medications, and you'd be surprised to find out how affordable this stuff actually is. And it's crazy how much money is being spent. And, I have people who, and this circles back to, other topics, but I'll just briefly say, with the, people are so concerned about keeping their insurance, which is important. Obviously, we need that for catastrophic events and, large diagnoses with big price tags. But a mammogram, people will hold on to their $800 a month healthcare plan, convinced that they're getting their free mammogram and free pap smear, free, screening, when really like a mammogram costs you $75. So like, is it really worth it when there's other things out there? And so when you pull back the curtain and you see how much has been inflated or, shielded from the general public, it's crazy because, there's people out there that don't have access to healthcare or access to a healthcare provider to even talk to them about prevention and, the right medications or the right decision for them, or giving them the information so that they can make an educated decision. So all that marketing and stuff comes full circle right back into the pockets of big pharma and big food. So.
And so, for instance, talking about inflation and all of that. So Kelby broke his hand playing powder puff volleyball.
When? This
Don't
week?
even ask me how that happened. No, that was last week.
Okay.
Not
so
even
recently.
angry. Showing off to his
okay.
friends. Punched a padded wall to show how heightened he was, and then he busted his hand.
Sure.
And so when I took him somewhere, because I don't have x-ray capability in my clinic, and so we got to get it x-rayed. We got to make sure that it's, not broken.
Yeah.
And so I took him to, I'll call it out, it's a great place. It's Lighthouse Convenience Clinic up in Osage Beach. And I'll tell you what,
it's an urgent
I went
care,
there. Yeah, they do urgent care, and we walk in, they do an x-ray, I see Dr. Martin. It was the best visit ever. I think I spent $163, Courtney, on that whole office visit.
Including your
whole
x-ray.
office visit. Yeah. My x-ray, his splint, the doctor's visit in itself. And that's, if I'd have took him to an urgent care or an ER, I'd be paying out the gazoo right now, for something that we can do at a lower cost.
Yeah, and most standard copays for an ER visit are anywhere between $150 and $300 for a visit.
Oh, yeah.
So, and that's just the copay.
It's out of control. And I don't think people, a lot of this is starting to come out and people are starting to recognize that more. And they utilize things like Lighthouse Convenience Clinic because even their co-pays are more expensive than what it costs them to go to a clinic like that. So why wouldn't you?
No, absolutely. It comes down to being, financially sound and making the right financial decision. It's crazy, and honestly, when you're in a time of need, you don't want to be thinking about money.
You don't. But it's also in an environment where you're not rushed. You have time. There's not this urgency to get you in and get you out. And it's just a different experience. And, it's going to grow. This is kind of where healthcare reform is starting. And I truly believe that.
I think so, too. I do, too. I think that more and more I have met several people who have never heard of, concierge medicine or DPC or even very many private practices anymore. And I think that more and more healthcare providers are going out on their own so that they can have not only that balance, but also, start educating the public so that we don't have these big problems that we're seeing today.
And part of the problem, that's what we're going to get into this, because we're going to talk about a little bit about Big Pharma. We're going to talk about 3 of the biggest scandals of Big Pharma. And when we say scandal, I'm talking about life-saving medication that the prices just are in
price gouging.
Gore. It's price gouging at its finest. Yeah. And so one of the first times this happened was with the EpiPen. Right? We need the EpiPen. For people that have anaphylactic reactions, that is a life-saving medication that you need. And when EpiPen first came out, it literally cost $1 to produce a 2-pack EpiPen. Right. And so whenever I talk about this, they were $1 to manufacture it. And then what ends up happening is that they find out this is a life-saving medication, so we need to increase the cost, right? And back in 2016, the price went from $100 to $600. But
and
that's
people
not
pay
even,
it because you say it,
they do pay
life-saving medication, right? Like
it's
valuable.
Pay it.
It's your family member who would die, right?
It is. And what the part that gets me is that whenever we talk about lobbying, and I know me and you have talked about this, and because I truly believe the definition of lobbying is it is a legal form of bribery. That is simply all it is. We are paying billions of dollars to Congress in order to keep laws in their favor, which the laws in their favor just increase their pockets, right? And that's exactly what's happening. And so what ended up happening with the EpiPen is that, this guy bought out the EpiPen, increases the prices, but first he hires these lobbyists to spend billions of dollars within Congress to make these state-regulated guidelines that schools require EpiPens. And so he gets this in the push, right? And he gets all these states on board. And now an EpiPen, there's other brands, but EpiPen's the only one you hear about because it becomes a monopoly. And whenever you pay that $1 billion in Congress, those other companies, you can just might as well kiss them goodbye because they're not going to be, present in anything.
It's like it circles back to marketing, right? Or SEO optimization. Like the longer you're there, the more money you have, the higher you rank on Google, right? Like the first one you see is the first one you get. So
And the thing about the EpiPen that drives me crazy the most is that they did spend all that money lobbying within government to make states require this in their schools, and that they won. It worked. And then once they got those federal mandates to where these schools had to keep EpiPen, which I don't think is necessarily a bad thing. Right?
Because no, I agree. And I was about to say they could have done the right thing for, $500,
right? Right.
And just like gave them to all the schools in our country if they cost $1 a piece. And these are the children. Right. This is our future. Why would we want them to suffer from a, peanut allergy or a bee sting while they're at school? It goes, that could go deeper and deeper. But we'll segue back what you were saying.
And so when we talk about, in 2016, the price went up to $600. But what was happening before that was in 2013, EpiPen had risen to a $265 for your 2-pack EpiPen. And so what
and that's
this
retail,
company did,
or was that?
Yeah, that's retail.
Okay.
And what the company did in that moment was they spent that $4 million lobbying for the federal EpiPen law that got these laws in within the school. Then they didn't stop there, Courtney. They didn't stop there. Then they went in and made they did this subsidizing with the government that said that the federal government would subsidize the growing cost of EpiPens for cash-strapped states. So what that meant was states that couldn't pay for it, federal government would step in, and then they would pay the remainder for the EpiPen for this company. Once they had those laws in effect, that is when the price doubled to $600 because they had them in the belt, right? Now they've got these laws in place. You have to have them.
And you have to pay for it no matter what.
Yep. Yeah. If the state can't afford it, that's fine. Federal government would step in. So now that they have all that laws in place, they're going to crank the price up now to $600 from $265. And that's exactly what happened. But
and it doesn't protect the community at all.
No, it doesn't. It's all profitable based. And that's what we have to realize, because I think there's a really hard fine line of how people, because there's a mistrust for government that should be there, but they truly don't know what's good and what's bad, because good things come out of it. But
right, no, absolutely, and there's two sides to that every time. Like there's something good, there's a good initiative, right? Like they're in the EpiPens in the schools, which is wonderful, and why wouldn't we, right? Why wouldn't pharmaceutical companies and state administrations and the government come together to provide that? That's perfect, right? But as soon as somebody gets that American greed and cranks it up, that's when it becomes dirty and bad. And that's where
it does become dirty.
So many of the lines are blurred. And that's why everybody, not everybody, and I think that most people do have a distrust in, what's real and what's not, and what's great and what's not, because everything is so shielded. And unless you live that life and you're on one side of it, you really don't know what's fact or fiction. And I think that is difficult.
And when companies grow big, it comes about profit. It becomes about profit. And just like when we're talking about healthcare facility, it's all about profit. But they're not the ones that are in the neck that are seeing the patients that are suffering and that can't afford these medications and can't afford this and that. Their focus is on numbers. Yeah, they want those
and when you're in the top
rise.
of the C-suite, you don't look down, not often. And so that's the part that's unbearable to me. And don't get me wrong, we all, everybody here works for a paycheck, wants, money to take home, and strives to, increase their bottom line in their homes and then their businesses. And that's capitalism, right? Like that's something that's going to happen. And we want that. We want to be able to, grow, but there's a point where it's wrong and it's too much for not enough or for the wrong reasons, and that's the point that we're trying to drive home, and that you can see in almost anything.
And so you talk about a paycheck, and so that's something that we forget, that we have tools. We have Google now. You can almost do anything on Google, Courtney.
Have you heard about Google?
Have you heard?
We'll put a link below.
Right. But when we talk about the CEO of these pharmaceutical companies, look at what they're bringing home.
Oh, I know.
Novo Nordisk.
It makes me
CEO
so jealous.
Brought over $2 million in revenue a year. Salary. And their salary a year. Novo Nordisk. And that is diabetic medications, that is life-saving medications, but this is what these CEOs are bringing home. And then let's talk about, there's so much money waste. And I know that there's so much more to it, Courtney, but when I think about, I know we were talking about this the other day, how these pharma drug reps, come within the clinics and they say, okay, I remember them doing it, and everybody gets a $25 voucher to Outback. For one, why should we eat that much food? But don't even get me started on that just yet. But $25 to Outback just so you can come talk to me about your brand new $20,000 drug.
Sure.
And, even at the time that it was happening, we bring them in. And a lot of the times my experience with that is, I worked in lung specialty, and that's pulmonary specialty, to where we're treating patients with COPD. We're treating patients with emphysema. They need inhalers. These are another one of those life-saving medications, but the cost of them are outrageous. And the only way we give samples is to bring in these drug reps. And I'll tell you, it was brutal. Who wants to spend their hour of alone time listening to a drug rep your whole lunch? Like, it wasn't my favorite thing to do. I'm not going to lie.
And
but
you and I talked about
to get our
this
patient samples.
Sure. No, right, because otherwise they couldn't afford them. They're wonderful drugs. And these pharmaceutical companies, they do provide those to us. And that's important to note. Like, they do put a lot of research into that, and they formulate these drugs. And as women and professionals of science, like, we do need drugs, like we mentioned before. And so it is important to say that, yes, we need that. And we talked, Jasha, how you and I have had very different experiences with drug reps, and how, and maybe that's our locale. And, and I'm not honestly sure if the laws are different in Florida versus Missouri, or if they're the nationwide, but I've in the ER we don't have drug reps at all, right? Every once in a while you'll see a rep or so for a surgical device or something. But when I got into primary care, I met a lot of drug reps, and I only had lunch maybe once or twice a month, if that. And every interaction that I had was very valuable in the terms of like learning about the new guidelines or the new drugs that are available. And obviously there is they're pushing and educating you on their particular drug. That's their job. But it always posed questions for me that I probably wouldn't have considered otherwise. And so as a healthcare professional, it was my job to say, oh, I wonder about that and this, that, and the other, and go home and really dig into, is this a good drug for me to use, or should I continue using this, or should I consider a different drug, whether it came from a different rep or not? And so it was very valuable to me. And they no longer provide, meals for you. They'll provide what's called snacks, right? They'll bring something from Winn-Dixie and give you cookies for the clinic, or, maybe a fruit platter or a vegetable platter, but there's no more gift certificates or anything like that, at least here in Florida. So I had a really good experience.
So what I've noticed is, when things change, it always comes from your area of the country, and then it trickles here, right? Slowly trickles. My cousin in NC used to joke about this, because have you heard this song yet? Of course you haven't, because you're on the other side of the world. We always get the good stuff first, right?
You're in the middle. It's coming.
But it's true, and it's just
I believe that.
We hear about California making these rules and laws on their food and all these regulations, and that's because the information starts there first for whatever reason and slowly trickles.
Sure.
And we've talked about how your people and your clientele, they really do know the new nutrition and the new guidelines. And I'll tell you, where I'm at, they don't, Courtney.
Yeah,
they don't.
And that's why it's great that you're there, because why wait until it trickles to the middle,
Right. But it's such a slow trickle. It's like drip. And then in about another day, it might drip again. But it's just how information flows, and it's how it works. But it's part of the problem too.
Absolutely.
And when we talk about that, I know I have my biased opinion about drug reps. I didn't accept them in the kidney department because in kidneys, I don't like drugs. I am so thankful for my mentor who taught me, somebody comes in with a problem, the first thing you're looking at is their drug list.
Check that med
And
list,
you will likely find that problem in that drug list. And I will tell you, Courtney, he was right 99% of the time.
I believe it, especially, if you go back to episode maybe 2 of ours, that when we talked about all the polypharmacy and how many drugs people are, and they don't even know why anymore. They don't even have that problem.
Throw it at them. Let's just throw it at them, Let's just, you got a problem, here's the med. And, part of it is, too, we're part of the problem, and I want to touch base on that, too, today, but I'm going to get through this big pharma stuff, but we are part of the problem. We create these things. If you think that you're not part of the reason big pharma is so big, I challenge you to get up right now, go open your medicine cabinet, and tell me that's not true.
Right.
We pop ibuprofen for every small scratch, niche, cranny that we get. Even our kids do. And I'll tell you, one of the worst commercials, it literally makes me sick to my stomach every time I see it, Courtney, is an ibuprofen commercial, because
I don't even realize commercials. I would keep seeing this commercial on Tesla. That's the only commercial I see.
As crazy as it is.
And I'm so fascinated by just watching these people awkwardly dance. I don't even know what they're talking about on the truck.
And so the fact that I've seen an ibuprofen commercial in the past 2 years of my life tells you how often it runs, because I don't see commercials either. But I still see that ibuprofen commercial, and it'll come on. Oh, yeah. And people think it's an over-the-counter medication. It's safe. I don't know how many people.
Sure.
My son was on the phone with me the other day, and he's like, well, I'm going to go take some ibuprofen. And I hear in the background, he's like, oh, yeah, just take 5, man. It's fine. I'm like, do not take 5 ibuprofen.
No, 3's enough if you need it.
I have put people on dialysis from ibuprofen use alone. And those are the things that people don't see and they don't know because it's an over-the-counter medication. They think it's safe, right? It's safe.
Yeah.
But what I'm finding and what I found in this past 2 years, I don't trust anything anymore. I'm going to look up these ingredients myself and make sure that it's safe because our country does put profit over people. They push an ibuprofen. They want you to buy their product. You keep it in your house for any time you get a headache. Nobody tells you drink some water. You're likely dehydrated or, pain
or
is
what was
normal.
the course of that headache? Yeah, and it's okay to experience a little bit of pain here and there. Your body's working through it.
Pain is how we know something's wrong. The improvement of pain tells us that it's improving, and so it's important that we identify this and that we stop reaching for drugs every time we have an issue and that we start asking, what can I do instead of taking a drug? Is there anything that I can do lifestyle wise? We've got to start those conversations because
and that's the hard part, right? I mean, it really is. It's the hard part. It all goes back to the time and the willingness of the person on the other side of the table. And, whatever works, honestly, for somebody is whatever they're going to stick to consistently, right?
But the consumers guide this. We have guided it all along. And whenever they first, I remember antibiotics came out, this came out. And so you go to the doctor and you want something in your hand, you want to leave with it, and you want to know that you've got something to take that's going to fix you. And that's where we came.
Now.
And that's where, providers got to the point to where they're not going to listen. They don't want to hear lifestyle.
Yeah.
So we just got to start giving out drugs.
Give them what they want.
Every time. Yeah. And it's escalated from there and it's out of control. But more often than not, I was talking with my staff the other day because we were talking about my nutritional counseling and because I truly believe you don't always need a drug. We can do this by talking nutrition and by changing some lifestyle modifications. But they brought up a good point. They're like, Jaysha, if your clients don't leave here with something in hand, they're going to think you did nothing. But it's true. Why is that true? You go to a marriage counselor, what do you leave with? You leave with their education and their knowledge, and I have
nobody
10 years
wants that anymore.
Nobody wants it.
And
they
some
want
people
that
do.
Quick fix.
It's not fair to say everybody, but even in emergency medicine and even in primary care and even in today's settings, whether you're doing nutritional counseling or not, they do want something like you better print out a nutrition guide or an elimination diet from the Functional Medicine Society before they leave, so they feel like they got
something in hand.
Yeah, or you better shoot that X-ray even though you don't think it's broken, or it's not even indicated, or whatever, so that people feel that they got something, and it is so strange, and that's the psychology behind marketing,
but they underestimate the value of knowledge.
No,
knowledge
exactly, because
that is so powerful.
Absolutely. And we've gotten that, and like we talked about briefly, that's at the top of everything, and everybody it's been there for so long, it's now ignored. It's like that little penny at the bottom of your washer machine that you see it there every time you change your laundry, but you're like, whatever. And you just leave it there and you leave it there and you leave it there. And then it's ignored and it's ignored and it's ignored. But really it's important that it's addressed, right? And when it doesn't get addressed for, consistently over the last, decade or so, it becomes, you have these huge chronic issues that we're seeing today in our healthcare and our populations. 78% of our population is considered overweight or obese.
Oh yeah,
that's terrible.
It's problematic.
And then we have, absolutely. And then we all know that obesity leads to nearly everything: inflammation, which leads to cancer and chronic disease and coronary artery disease, and so it's a snake eating its tail. But the only way to fix it is for people to truly value their own lives and take it into their own hands and utilize the knowledge resources that they have through their healthcare providers or through their own education. And until that happens, it's always going to be an issue. And it is hard because our society is designed to keep us sick, to keep us. It is like that. We live in a very toxic food environment. We are very lucky to have an abundance of food around us, but because it is so easily available, and now we are so maxed out on our time because we have, 2 people working in the home instead of 1, which was historically the norm, and then you've got your kids in sports and you've got this, that, and the other. And, before you know it, you're in a drive-through 3 nights a week because you're exhausted. And until you can really make it a priority and find really a way that can work for your life, that's the biggest hurdle, in my opinion.
So I preach this all the time.
It is so hard.
In my clinic, we wait till we're smacked in the face until
What are we waiting
decide to
for?
make a life-changing decision. But
No, I
what
agree.
people don't get is once you're slapped in the face, that organ function
too late.
is gone.
Yeah,
we can't
it's
get
too
that
late.
back.
Yeah. And what you see on lab work has been happening in the background for years before it shows up on your labs.
Yes, we don't. You know, I'll have so many people that their labs are good, and they say, "Oh, my labs are great, so I'm fine." No,
Yeah.
It's amazing that your labs are not good, but we've got to make sure that it never changes. That those labs
Right.
stay good, because if we stay
Right.
the way that we're eating and that we're living right now, there's going to come a point that those labs are not going to be good.
Right. And treating the person as a whole. Like you can look at a piece of paper and see their labs and it looks great. And if you look up and you see somebody who's, 30, 40, 50, even 100 pounds overweight, that's an issue. Like, don't just say, oh, yeah, everything's fine. We'll see you again in a year. Like, no. Stop. Address an issue before it becomes a problem. Or, if you see they've got, pale conjunctiva or, all of these other symptoms that clinicians are trained to look for, you have to pay attention to the whole person, not just the labs on the paper. And so
Right.
you're right. And
Right.
people are
And you
so
have to
accustomed to
see
thinking,
what's
give me that check mark so I
happening.
know I'm okay.
And I have people that come and their cholesterol is a little up and they're overweight and they say, "Well, my doctor says it's fine." But we've
Right.
gotten to the habit of, yeah, it's fine. No, it's not fine. It's only fine until it's not. And when
Right.
it's not, that smack hurts. And it's
Right.
usually
That's-
something catastrophic.
Right. Like,
You
what are
know,
you waiting for? A diabetes diagnosis before you change? Are you
yes.
waiting for a cancer diagnosis? Are you waiting for high blood pressure? And that is hard. It's hard to look in the mirror and like say, I'm ignoring this, because a lot of mental health comes into play with that. We live in denial,
does.
or we're convinced everything's fine because we can't burden on just another problem in our life. And so less is more, and we have to learn to live a little bit simpler. But, you say, it's not fine until it's not. And if you apply that to anything else, take our kids for instance, right? Like we both have teenagers. So like if one of them was smoking a cigarette just a little bit, you're like, oh, it's fine. It's just a little bit over, over my rule, or it's just a little bit out of line. No, it's still bad. Like, quit it. Like, we need to revert that. We need to reverse that and quit allowing those things, or intervene quickly, not just wait until you start smoking 3 or 4 and then intervene. It's one of those things where take that same principle and apply it to something that makes a little bit more sense. And sometimes that can kind of peel the curtains back for some people, and it really smacks them in the face in a good way, and they're like, oh my God, I never thought about it that way. And breaking through to people, which I'm sure you do on the regular when you're having your consults with your patients, and that is honestly the best part, because until you can really get them to see it, there will be no change. And so that's where that knowledge and power comes in.
I see those light bulbs click on all day
amazing.
in my office, and I love it. But
It
you
feels
know that
great.
they're not
Yeah.
getting that knowledge anywhere else.
But
We've got
and
to
that's
start
why people
asking for
continue
the
to come see you.
knowledge, Courtney. We got to start
Everywhere.
asking for the knowledge, and stop asking for that medication fix.
Yeah,
We've got
for
to start
sure.
making
And that's
changes that are going
little
to
ripples.
Yeah, you get on that medication, you're going to be on it forever. And
Yep,
then you're going to
little
have
ripples, and
probably
so-
10 extra medications on because of the side effects you got from those medications they're trying to treat. But I found this book, and I'm going to show it because I'm a super fan of this book. It's called How Not to Die. This is a Michael Greger. And
I listened to that on podcast, or not
Did
podcast,
you?
on audio tape. Yeah. It's fascinating.
It's eye-opening. It's eye-opening because we truly devalue the role that nutrition plays in our health. Completely
100%.
devalue it. I am not saying, I'm not going to be one of those people that sit here and say that food cures all. All we got to do is change our food. That's not true.
Sure.
There's something.
It's a big
we
part,
need medicine.
though. It really is a big
But it's
part.
more than a big part, Courtney. We do know that lifestyle and diet is the best way and the least risky way, the most efficient way to actually reverse and prevent cardiovascular disease. We know that.
Yeah.
But we don't even teach it. We don't talk about it when you come see the doctor. They
Well,
have
we
30
do.
patients. I'll say we do, but we made
And
our
so-
own rules.
Yeah, and I agree. I agree
patient-goal and
100%.
patient-oriented.
The question is like, how do we fix that? You and
So
we will make ripples, and we will talk to people, and they will tell their friends, and people will start to grow within our communities. But
and that's what happening.
Our
that's why I've
community,
had
the large
these growing
corporations.
pains these past couple of months is because that's exactly what's happening. But I want to read this passage out of this book because we've talked about this, and this hit home for me. When I read this, I'm like, oh gosh, I love this book, and it's a thick book. I'm still working on it. But it says, I opened my eyes to the depressing fact that there are other forces at work in medicine besides science. The U.S. healthcare system runs on a fee-for-service model in which doctors get paid for the pills and procedures they prescribe, rewarding quantity over quality. We don't get reimbursed for time spent counseling our patients about the benefits of healthy eating. If doctors were instead paid for performance, there would be financial incentive to treat the lifestyle causes of disease. And until the model of reimbursement changes, I don't expect great changes in medical care or medical education.
Yeah,
and
that's
it's so true.
Summed up exactly what we talked about in episode 1 and 2.
That's exactly what we talked about.
And until that happens.
Yep. And I want to say this too, because when I was reading this book, he's an MD. And whenever he was going through medical school, his grandmother, 65 years old, had a massive heart attack, goes in the hospital, nothing they can do, 100% blocked, leave her medical management. She's not going to live long, kind of left it at that. He takes her to a more functional medicine doctor who changes the diet and gets rid of things like excessive meat and excessive dairy, more fruits, more vegetables, the nutrition that actually fights disease, right?
Sure.
And she lived 31 years. 31 years. And we devalue the effect of nutrition that we have when we're talking about fighting disease, because man-made diets are the cause. Have you ever seen a deer in nature grow obese and fall over from heart failure?
I can't wait
No.
to. But
No. Because
I
they're
know.
eating what they were intended to eat.
What they were intended. Exactly. And
our pets do.
Oh, our
because
poor
we
little
feed them
pets.
our food.
Yeah. We feed them our food.
We do.
Or the food from, IAMS or wherever,
I'm going to read this Thomas Edison quote because this is one of my favorite quotes. You might have seen me post it because I posted it, and I love it because even he knew back then where medicine is going towards. And this is kind of part of that healthcare reform, because we know that diet and lifestyle play a significant role in preventing disease. And if you want to live a healthier quality of life, we have to do it in a lifestyle way, not just throw 10 medications on you, because that doesn't help anything. You're still living your retirement sick in doctor's office, in this doctor's office, and that doctor's office from all the side effects from the medications. But Thomas Edison said it best. He said, the doctor of the future will no longer treat the human frame with drugs, but will rather cure and prevent disease with nutrition. And he's not wrong.
No, he's not. And nutrition, before it was a tool, and now it's not. Now it's not in our society. It is a comfort. It is so correlated with gratification, and we don't eat because we're truly hungry. Most people in America don't even know what hunger is. I don't know what being hungry is, and I grew up, with less than what I have now, and so we don't know what hunger is, and so we utilize food as a social crutch. We use it as an emotional crutch. We use it to, appease ourselves or to please others. And everywhere you go, we're eating, right? Somebody's born, we eat. Somebody dies, we eat. Somebody graduates, we eat. Your family comes in, what do you want to do? Let's meet for dinner. Everything we do is eat, and it's a social thing. And so we don't see it for what it is anymore. And so that's why I think nutrition has fallen by the wayside in the majority of our population, because it's just something we do. It's not something we need or something that can help us. And for a lot of people, they view it differently than like how you and I are, as food is medicine, and it can really help.
But you knew me before, Courtney, and I think what our wellness centers are not even exactly the same, because you're molding your wellness center to what you've done. And I'll tell you that I went on this wellness journey myself. My wellness center is based on what I've learned and my wellness journey on my own. And people that know me, they're like, what is going on with you, Jaysha? I feel better than I did in my 20s. But it's because I learned these things, and why I came to the realization of why in the world am I going to work every single day of my life to retire sick?
No,
Why?
for sure. Absolutely.
Why are we
and I think a
doing that?
lot of people make that change. Most people will have that realization at some point in their life. And sometimes, unfortunately, it can be a little bit too late. Not too late. It's never too late to make a change, but it can be later than others. And then therefore it's harder to make that change. You know, you've lived your whole life until you're 30 and then you want me to change everything about it. It's harder. So it's important that we teach this to our children, the youngest. You know, I never grew up playing sports or being physically active. And so exercising for me now is like a foreign language. It is so difficult for me. Whereas, you know, my counterpart, my husband, he grew up playing sports and all types of things. And so it's just like a way of life for him. It's so easy for him to go and do anything physical. But for me, it's like, what? Why? Huh? And so it becomes more of like a task, and that therefore is harder. And so you know, it is more difficult the more and more, you know, we don't listen to our bodies or make those changes. And you're right. I did know you before, and you have made some not crazy changes, but like crazy strides is what I mean to say.
My friends and family that are here, they think it is crazy changes. But
no, you're not crazy because you want to be healthy. Like that's wild. And we have to remove the stigma from that, because even me, I eat smaller portions now, you know, and people will say you don't barely eat. And like, I'm not anorexic. I still have 15 pounds that I could probably lose. And, you know, but because I'm not eating what is deemed a normal portion, you know, people will say, you know,
for them.
Right. And, or for America. And those portions are ridiculous. Like subtly over time, they have gotten so large that what we think is normal is so far beyond normal. And that's part of the problem. And so by learning those things and taking it into your control, you really can make a big difference. So that's the burden. That is the hardest thing, is just getting to be able to make a change, and change is hard. And if you do it drastically, it's not sustainable. We need sustainability, because we need it forever.
And I've been doing this over a long period of time, and that's what people have to understand too. This change for me didn't happen in a day, in a week, in a month.
Right.
But it's been happening over a process. You know, and how I treat my patients is the knowledge that I've gained that has led me to the decisions that I've made and this healthier version of myself, I want to share with you, because I believe that knowledge is more powerful than anything else that we can do. And we do have big food and big pharma that fights against us. You know, it's almost like big food comes in, makes us sick, and then big pharma sweeps in behind it to try to save us, and we're still sick.
I mean, it's a snake eating its tail, and it's not going anywhere, not anytime soon. Like I said, ripples, right? And so we have to learn to help our communities, our families, our friends, and the people around us. And hopefully more and more healthcare professionals are doing this. And I believe they are, you know, to learn to navigate that a little bit easier for us and avoid it as much as possible. And to quit being robotics for big pharma.
We've got to quit being robotics for big pharma. We've got to quit thinking that drug first. We've got to start thinking, are you willing to change? You know, because I've said it before, if somebody is not willing to change, we're going to have to treat them with medicine. But we've got to start talking about lifestyle first.
You can have those, you know, co-therapies, you know, temporarily while you bridge the gap. Get them off. You know, like it is important. And like the goal is to always get you well and get you sustainably well without, you know, any crutch, any medication.
Meds get put on and they get forgot about. Do you know how much Protonix I see that is on patients and they're on it for years? Really? It's not meant to be a long-term medication, and it's toxic, but it happens. And we've got to start addressing medications more, and we have to be vigilant with it. You know, I can already tell, Courtney, our next episode is going to have to be Big Food, Big Pharma too.
Well, let's end the. I know. I could talk forever, but let's end the episode with a good win. I had a patient this week who she's down 35 pounds in the last 4.5, maybe 5 months, and she's doing really, really well and made a lot of changes. And she's exercising. She's made a lot of dietary changes, and we pulled her off her blood pressure medicine this weekend. That's
my favorite thing to do. That is,
oh my God, so much fun.
Absolutely,
I was like, this is the best win ever. And she's like, yeah, I haven't taken it. She did a log at home for me and brought it in. And it was like, 2 weeks without any medication at all, like perfect blood pressures, and she feels great.
And getting them off those statins, it's life-changing for them. And it's almost like you're giving them the power of their own health back.
Absolutely.
And they're in control now. We got to take the control back, and we've got to care more about our health on a real personal and nutritional level. I truly believe that. But I'm so glad that we got back together today.
I know, yay! Well, enjoy your weekend.
And it won't be as long in between this time, Courtney.
No, it won't. And moving forward, we may be doing a little bit more frequently, a little less video, a little more audio. So stay tuned for that. We're getting our own little cameras or something soon. Our experts here, Tim High with Caliber Sound and Brian Swino, are going to help us get set up for in between, because Jason and I like to talk too much. So
yeah, and we'll be able to set you up, Court, with video, so we should be still able to have some video too. So it's going to be good. I'm glad we got back together today. I'm super excited to do our next one now.
Yeah,
Another
absolutely.
Big Food,
so
Big Pharma.
Let's
We
put
got
a
to keep
pin in it
talking
and we'll
about
be
this
back.
because we got to get this information.
We got to
out,
come
but
up with solutions.
solutions. That's right.
Yeah,
maybe that's
if we're gonna change, we got to talk about it and then be about it. We can't just talk about it.
That's right. Well,
All right,
great
well, I'll
talking to
see
you,
you later.
Court. I will see you next time.
All right, bye.
Bye.